A common term confused with disease is illness. Here I want to distinguish to you, and I want to differentiate what is the difference between disease and illness. These two terminologies, for some people, they don't know what is the difference between them. The difference between disease and illness. While disease suggests an entity with a cause, illness is the subjective reaction of an individual to disease. So disease suggests an entity with a cause. Any disease has its causal factor. Maybe it's a bacteria, or it's a parasite, or it's a virus that is the causal factor for that disease. So a disease has an entity cause, the causal factor. But illness is the subjective reaction of an individual to disease. Let's say if a bacteria enters the body, that bacteria will cause certain kinds of symptoms. What a patient feels is what we call as illness. So illness is what a patient feels after the subjective reaction to a disease, or subjective reaction to the entrance of an microorganism in the body. So if a bacteria enters the body, or if the parasite enters the body, or if the virus enters the body, what is the reaction of that virus? Maybe virus leads to fever, leads to tachycardia. These symptoms are what we call as illness. So illness, they are conditions of the body associated with disease. Usually, the illness can be divided in two terms, either in symptoms or in physical signs. And there is a difference between symptoms and physical signs. You must know about this. Symptom is what we call the complaints of the patient, Always a patient, when it comes in the ward, then says, what is your chief complaint? A doctor or a general practitioner asks, what is your general complaint? What is your chief complaint? Chief complaint, that is, it is the major factor which lead a patient to come at hospital. What is your chief complaint? Maybe it is stomachache, it is headache, it is abnormal abdominal extension. What is your chief complaint? So chief complaint is what a patient tend to tell a doctor that I don't feel well this side of the body. And then after that chief complaint of a patient, now a physician start to investigate what is wrong with this chief complaint. What is wrong? So when a patient say that maybe I feel pain in the right hypochondriac region, then a physician start maybe to palpate, or tries to find a way by which he can know what is wrong. If a physician know maybe there is enlargement of a certain organ, or maybe there is let's say hernia, that is physical sign. So a physical sign is elected by a physician. A physical sign is not elected by a patient. A patient doesn't know physical sign. A patient simply know about the symptoms. So the study of disease is done in pathology, as how we are doing here, but the learning of illness will be done in the wards. When you are going in the wards, and we see how the patients feel with different disease condition. That is the learning of illness, the learning of symptoms, which are the result of different diseases, and how to treat these diseases.